As UNICEF Kenya, we have a big focus on women and children, especially children under 5. We work a lot with health facilities to increase access and utilization of maternal and newborn services. So part of that work is making sure that facilities are open to give access to those services. They are open at night. And one of the main reasons why there are access issues for women is facilities being closed at night. One of the reasons why facilities close at night is because they don't have bills to pay for energy. Green technology in health facilities is just the concept of how health facilities can better use the energy that they have to reduce the blueprint for the planet, how they can use renewable energy, like maybe solar, and how they can use systems like water harvesting to reduce the cost that they have towards the bills of energy. So we got some funding from DFID to work in 5 counties. Yeah? We supported them to do what we call energy audits. And the energy audits is somebody coming into the facility and working with them, telling them that this is the kind of energy that you need and this is the kind of energy that you're using. So you're either overusing or underusing.
Mke wangu alipokuwa mjamzito kabla hajajifungua, ilikuwa ni jambo la dharura, kisha ikawa lazima nimpeleke hospitali mara moja. Sasa tulipofika pale kulikuwa na malalamishi mengi ya kwamba stima ilikuwa imepotea, na kawaida kama vile unavyojua mashini nyingi za hospitali zinaendeshwa na umeme. Kwa hivyo nguvu ya umeme inapopotea basi inakuwa kuna balaa.
One time we had a delivery. The mother had not delivered. So the lights were on in the beginning and everything was okay. Then all of a sudden, a blackout.
We installed for them solar panels and batteries that go on with making sure that the panels are running well. So the solar panels, what they do is they provide light at any time of the day and of the night. And they also provide uninterrupted energy. So what they do for those facilities that are on the grid, they provide backup for when there's a cut-off from the power. And those ones that don't have is that you have uninterrupted light all the time. We also provided them with LED lights to make sure that when they're using the light, that they are using just enough energy for them to be able to keep going.
Most public hospitals use a lot of resources in buying fuels for using in the hospital. Now, at times you find that they do not have finances for doing that.
This is a place where the supply of money is not adequate. So sometimes you go off gas. We cannot manage to keep on buying every time it gets finished. We buy another cylinder.
Biogas is needed urgently in most of our health institutions because of its advantages. Biogas is more reliable. Biogas is eco-friendly.
Sasa ingine unaendanga hospitali, ulikuwa umeenda kwa ugonjwa, sasa ingine unaona unatoka na ugonjwa ingine. Unaona nikaa kuongezea. Haikusaidii, juu ukienda upone hii, hakuna maji, unaokota ingine. Unaenda unapata choo siko chafu, unashindwa uingie ama ukose kuingia. Tena ukiangalia tu chini, unajua saa ingine unataka kunawa mkono, unapata hakuna maji kwa tap.
The supply of water in Kayole 1, you get the supply only on Fridays. We used to have a small tank that used to hold 5,000 liters.
So part of what we have to do is put in harvesting systems for them to be able to harvest that water. Part of what you need to conserve water is to make sure that only water that is needed to flush the loo is coming out. So you put in flushing systems that do not let all the water come out. When it's time to wash hands, it's what we call push and pull systems, where the only enough water that is required to wash hands comes out and is not left running. And then the same thing with the faucet is that to make sure the faucets are good enough that water is not dripping all the time.
Since we got those tanks, we are able to work the way we are supposed to work. With adequate water, we are able to do infection prevention. I feel so good because even when I'm admitting a mother, I'm not worried because our beds are clean, the maternity is clean, linen is clean. And so with this situation, we are able to give skillful, or to do our work skillfully because we have everything that we need.
We realize that as much as we are providing these services in hospitals, the mothers, let me say, the mothers or any other patients that visit the facilities, they go back to their homes and it's not in, let me say, good shape, or it's in deplorable conditions. When they're in hospitals, we do a lot of sensitization. But when they get back home, the circumstances are unavoidable. We need to work and focus on maybe addressing issues on after the hospital.
Even us as UNICEF going to the community and linking up with the Umande Trust and doing the biogas centers is part of the continuum of care, which is making sure that what we do in facility is linked to the community.
Within the biocenters, we provide showers, we provide toilets, and we provide a community kitchen. We also provide clean water, whereby we provided water kiosks.
Ukijaribu kupata mtu yote, mwanamke yote ambaye labda amejifungua wakati biogas imekuwa na yule amejifungua kabla ya biogas, utapata ni tofauti, na pia watoto wao wameimarika kiafya, kwani utapata frequency yao katika hospitali imepungua sana.
As we were building these maternities, and as we were putting in the water harvesting systems and the energy and the light and the solar panels, we included a lot of the political leadership that were directly linked to those facilities. The most sustainable way of doing a lot of these activities is when the county governments pick them up. So we are sharing a lot of the lessons that we've learned over the first few years with a lot of the county governments, and we are taking them to a lot of these centers and showing them what can be done and asking them to pick them up. There's a lot of construction going on with counties, so we're advocating for them to come up with the plans that we've made for them when they're doing their new construction for their hospitals and for their health centers. At the end of it, the hope for UNICEF is that it's going to increase access to maternal, newborn and child health care services, and that it's going to reduce the mortality for women and children and newborns over a period of time.